A lot of paper here.
Hi, everyone. We'll go ahead and get started now. Thanks for joining us.
Good afternoon, everyone. It's Elizabeth Pittman here on behalf of Secretary Janet Mann. She is unable to join us today. She's traveling to DC to learn about some rural health transformation. She asked me to do the welcome and closing for her. It looks like today's meeting is going to focus on incentive outcomes and quality measures for the qualified health plans. And hopefully we can have some good discussion about that and what we want to see moving forward. With that, I'll turn it over to Ms. Jen Deckman.
Thank you. There is an ARHOME quarterly report available. We're not going to discuss the usual content of the ARHOME quarterly report because we have a lot of content today to discuss with regard to the quality metrics, but the quarterly report is available. It'll be posted online, and if you're in the meeting room, there's also copies right up here at the front of the desk. And with that, let's move on to the 2024 health quality measure results. So we'll be talking about these terms here, and I want to tell you how we're using them. When we talk about measures, we are talking about the metric that we are looking at and how it is measured. So we're talking about the percentage of women who received a mammogram, for example. Incentives are those carrots, for example, that QHPs are offering to beneficiaries to incentivize receiving preventive care or other care. And that, for example, would be the QHPs offering a cash award for beneficiaries who receive a mammogram. Our targets are our goals. Each slide you'll see that there's a mark on the slide that indicates whether a higher measure, higher than the target is better, or lower than the target is better. And we'll discuss that too as we go. And penalties. Penalties can be assessed against QHPs that fail to sufficiently meet targets. There will be a lot more on targets and penalties in the December meeting than there is today.
Jen, before we move on, one thing I did forget to remind everyone of, this is being live streamed on Arkansas PBS.
Yes, it
Just
is.
wanted to make sure everybody was aware. Thank you, sorry about that.
So in 2024, our QHPs were required to offer 2 health improvement incentives for each focus. These are the focus groups. We've got pregnant women, particularly those with high-risk pregnancies, individuals with mental illness, individuals with substance use disorder, and individuals with 2 or more chronic conditions, as well as individuals living in rural areas. Thank you. The QHPs are required to include activities to support the health improvement initiative in their annual strategic plans, which is another topic that we'll be discussing in the December meeting. Here is our total enrollment. You can see a tall red section. This is over the last 3 years. This is the overall ARHOME enrollment. We have QHPs that are with Blue Cross Blue Shield. Those are in blue. You can see BCBS, Health Advantage, and Octave there. And the Centene QHPs are in green, Ambetter, QCA, and Qual Choice. You'll see those are in blue and green throughout the presentation to differentiate. I thought we'd start with looking at the overall outcomes. This is a visual showing how we're doing overall with the QHP results. The far left column in green, this is the measure that all of our QHPs met the target. Next, we have a measure that most QHPs met, but the bulk of the measures are in this orange and this dark orange column here. Most QHPs did not meet these measures, and no QHPs met the measures on the far right. We're going to keep this in mind as we go on to the incentives, followed by the measure results. Our preventative care measures, which we're going to visit next, the QHPs are required to offer improvement incentives. These are the Blue Cross QHPs for all 3. There were awards to beneficiaries for a wellness visit, a cervical cancer screening, a mammogram, and a chlamydia screening. You can see in the third column over how many were awarded and what percentage that was of the eligible beneficiaries who could have taken advantage of that incentive, as well as the total amount awarded by these QHPs. For Centene, they awarded beneficiaries up to $500 in rewards for completing healthy activities, challenges, or power-ups in the My Health Pays portal. Members can use those to shop at the online store or convert these points into money to use towards healthcare related costs or monthly bills. And you can see again the number of beneficiaries who took them up on it as a percentage of the total eligible and the amount that was awarded. Now we'll look at the outcomes of those measures that we just saw incentives for. This is showing us how each QHP did. You can see at the top, our 2024 target is 46%, and you can see that higher is better. The performance of each QHP is lined out in blue or green, and you can see there's only a single point for Octave. That's gonna be on several slides. Octave is newer than the other QHPs, and so you'll only see the single point for Octave on these slides. They don't have a trend measurement just yet. You can see here that there was a slight decline in several, and it held steady for BCBS and Health Advantage. All QHPs still below target for this measure, though. This is our demographics. We've broken down the same information to show you how urban, rural, white, and Black beneficiaries are all doing on this measure. You can see our target here is still 46%, but everyone from every demographic is below target. I do want to point out, if you look at the x-axis there, we are only looking at 35% to 53% for this entire chart. So we are zoomed in, and it's for visibility, but it may look farther apart than it actually is if you haven't noticed. The target spread there is not actually very big between all of these. We're looking at approximately 43.5 on the top end and about 40% on the bottom end. Our rural and white beneficiaries performing about the same, and then our urban beneficiaries performing better than both of those groups, and Black beneficiaries performing closest to the target. Here's our chlamydia screening in women ages 21 to 24. As you can see, our target is 57.3%, and this is the performance of each QHP. Again, notice that we have zoomed in to show differences between each QHP, but the range here is only 40% to 60% on the entire chart. So we do have some differences here, but everybody experienced an uptick in 2024. And here it is a breakdown demographically. So why are we reporting on this? Chlamydia is the most commonly reported STI, and it's easy to cure when it's detected. However, most people have virtually no symptoms and may be unaware that they're infected, and left untreated, chlamydia can affect a woman's ability to have children. So as a recommended well care measure for young adult women who are sexually active, we report on chlamydia screening as a women's health measure. You can see here that the target is at 57.3%. Our Black beneficiaries performing well above the target, lower numbers for urban, rural, and white beneficiaries. So to summarize our preventative care measures, cervical screening, cancer screening continued its decline, which is part of a national pattern that we're seeing of decline in cervical screenings. Black beneficiaries across both preventative screening measures had better rates than white beneficiaries. Urban beneficiaries had better rates for cervical cancer screenings than rural beneficiaries, but similar rates for chlamydia screenings. Our best performer was Qual Choice, a Centene QHP, and Blue Cross had the best performance. I'm sorry, best performer in chlamydia screenings was Qual Choice, and Blue Cross had the best performance in cervical cancer screenings. Do we have any questions about preventative care? Okay, moving on to maternal and prenatal care. We're going to look again at the incentives first. These are the incentives offered for the measures by the Blue Cross QHPs. Again, you can see some cash rewards here for $50 per visit, up to 4 visits for prenatal visits, $25 for engaging with care manager or care advocate, and $100 for receiving contraception at a pharmacy or other method of contraception within 90 days for a live birth. And you can see there the number of beneficiaries awarded as a percentage of those eligible and the total amounts awarded. Moving on to Centene. There were no specific incentives, but they did offer a Stay Smart for Your Baby case management program, community baby showers, where attendees could receive gifts, and a farm box program where attendees could notify farm box that they were pregnant and receive up to 4 boxes in total. I'll give you a moment to look at the numbers awarded out of the percentage eligible. This measures our most or moderately effective contraception, 90 days postpartum for those aged 21 to 44 years, and a comparison of how all of our QHPs performed. You'll see the performance very tight there. They're very close on the performance measures. We saw an uptick for the Blue Cross programs and a small decline for the Centene programs, but all performing very close there. And here is our demographics. There is a note here that I want you to see. The 2019 through 2021 rates were calculated based on 60 days. And beginning in 2022, the rates were calculated based on 90 days. So there is a difference in the first 3 points compared to the last 3 points. You'll see that our urban rate is performing lower than the others, with rural and white beneficiaries performing about the same, and Black beneficiaries performing closest to our target of 58.4%, but none meeting the target this year. This is most or moderately effective contraception for all women, 21 to 44 years, and here's our QHP performance for this one. You'll see a slight uptick there, or holding the same for all QHPs. And here's how it looks by demographic. Again, higher is better, and we see a decline here, headed down from the PHE, our public health crisis, being over and ending, and then a continued decline. But there is an uptick. We see a bounce from 2023 to 2024 here. We still have not recovered in many of these measures from our pre-PHE rates. Okay, this is low birth weight as a percentage of live births, weighing less than 2,500 grams. Close to our target, right down here on the bottom of 9.6%. We have our urban, rural, and white beneficiaries. For this target, lower is better. We want fewer. So you can see that the only group of demographically that's below the target are white beneficiaries. We do see an uptick among Black beneficiaries here. This is very low birth weight. This is live births weighing less than 1,500 grams. Again, you can see that the performance of each demographic is in about the same order as the previous slide, but we see again an uptick, a particularly sharp uptick at the top category there. This is in line with a national trend dating back to at least 2016. ARHOME has smaller numbers, and when we, instead of getting a gradual kind of slide upward like you might see on the national trend, we tend to have what looks like a sharper incline because smaller numbers. Do you have anything to add? This is preterm births as a percentage of live births, 17 to 36 weeks gestation. And you can see again, the demographics look about the same. We've got kind of a clump down near the target where our white and rural beneficiaries are, and a slight uptick there. Do notice the percentage points. It's an uptick, but it's from about 15 to 18. We're looking at 3 percentage points there on that uptick. So to summarize, Blue Cross had the best performance for preterm births. Health Advantage, a Blue Cross program, had the best performance for very low birth weight, and all plans performed similarly in both contraception measures. White beneficiaries continued to have lower rates of preterm birth and very low birth weight than Black beneficiaries. While contraception metrics have not yet returned to their pre-COVID levels, both low birth weight and preterm birth are better, which is lower on these measures than their 2019 levels. Do you have any questions on maternal or perinatal care? Hearing none, I'm going to move on to chronic conditions. Our Blue Cross QHPs offered $40 for achieving a hemoglobin A1C test of 7% or less and $50 for maintaining a ratio of 0.5 or greater for controller to rescue inhaler use. You can see there the beneficiaries awarded as a percentage of those eligible and the total incentive awarded. For our Centene beneficiaries, they awarded beneficiaries up to $500 in their point system and rewards for completing a wellness medical service or completing a challenge or power up in the My Health Pays portal. And you can see again the percent awarded and the total amount. This is a demographic slide showing hospitalization for asthma in younger adults, those 19 to 39 years. Lower is better. And so you're seeing a target line way down there of 0.6%. All of our beneficiaries are below 4%. We're getting close to the target line down there, and we did see a decline closer to the target, so that's positive for urban, rural, and white beneficiaries. We did see an uptick for Black beneficiaries. This is in hospitalizations, sorry, per 100,000 beneficiary months, not a percentage. I misspoke. And this is QHP performance for hospitalization for COPD or asthma in those who are 40 to 64 years old. Again, lower is better. And we can see right on the end there, we've got qual choice meeting target on the end at 7.1%. I think it's hospitalizations. I think the percentage is not, it's percentage. Yeah. This is hospitalizations per 100,000 beneficiary months. And here's what it looks like demographically. We see a very slight decline for rural and white beneficiaries and an uptick for urban and Black beneficiaries, all of them above that target line of 7.1. Here we're seeing hospitalizations for heart failure among beneficiaries 19 to 64 years. This is another measure where lower is better. We want fewer of these. You can see the uptick for Blue Cross and QCA, which is the Centene plan. We had Centene held about the same or increased on all measures. For Blue Cross, we had an increase in Arkansas BCBS and a slight downtick in Health Advantage. And again, the first year for measure with Octave, so just 1 point. And here's what that looks like demographically. You can see that our white beneficiaries are performing closest to the target, which is 11.7%, but still above it. Then rural beneficiaries, urban beneficiaries, and continuing a trend, an upward trend for white and Black beneficiaries both. This is QHP performance for all cause hospital readmissions, ages 19 to 64. So this is all causes here. Health Advantage, right at the top, is still below the target. They're all below target. So this is a lower is better measure, and everyone is meeting it. So to summarize these chronic conditions, hospitalization for heart failure continued an upward trend. Octave and BCBS had the best performance in all cause readmissions. Lower was better there. Qual Choice had the best performance in hospitalization for COPD or asthma in adults 40 to 64. Black beneficiaries had higher rates of hospitalization for heart failure than white beneficiaries, and there was a sharp uptick in 2024 hospitalizations for asthma in younger adults and asthma or COPD in older adults among Black beneficiaries. Moving on to substance use disorder. Blue Cross awarded beneficiaries $100 for completing a follow-up visit within 30 days of an ER visit for a substance use disorder, and $50 for completing a follow-up visit or receiving medication-assisted therapy within 14 days and attending 2 follow-up visits after a new diagnosis of substance use disorder. For the Centene QHPs, no specific incentive, but allowed participation in health assistance linkage and outreach case management program, and you can see the beneficiaries awarded out of those eligible and the total awarded. This is a look at our QHP performance. This is use of pharmacotherapy for opioid use disorder among those 19 to 64 years across 3 years. You're looking back to 2022 with the darker columns, and this year's performance is in the lightest column for each. Our target is 62.8%, and on this one, higher is better, so we're meeting the target. Every QHP did meet or exceed the target. And this is what that looks like demographically. We have an upward trend for all demographic categories here, with rural, white, and urban beneficiaries all exceeding the target. Here's another look at QHP performance. This is use of opioids at high dosage in persons without cancer. Again, a 3-year look. This year's performance is in the lightest column. This one is a lower is better measure. That means that no one this year is below the line where we would hope. But this is our QHP performance overall, and you're seeing sort of a trend downward with most of the Centene QHPs, and holding about the same or a trend upward for those with BCPS. Here's a look at that demographically. As you can see, holding about steady from 2023 to 2024 with a slight uptick in urban beneficiaries. Do note the scale there on the side, the percentage. We're looking at an uptick there, but it's like 0.1%. So to summarize, use of pharmacotherapy for opioid use disorder continued an upward trend in all categories, and concurrent use of opioids and benzodiazepines continued to decline in 2024. White beneficiaries had significantly worse rates in both measures than Black beneficiaries, but rural rates for both measures were better than urban rates. Do you have any questions about substance use disorder?
I'm not seeing any questions in the chat.
Oh, great, thank you. So here's another look at that first, that early slide that we looked at with the QHP results. Now that we've viewed the incentives compared to the performance, here's another look at our overall results for these measures. You will see a couple of measures that will be covered in December that you've not seen covered yet. The follow-up within 30 days after hospitalization for mental illness and the diabetes screening will be covered in December. And I'll give you a minute to look at this. Okay. Our next meeting is in December. We will let you know the date and location. The meeting topics will continue our 2024 quality measure review, behavioral health measures, diabetes screenings, and breast cancer screenings will be among those. We will review potential financial penalties for failure to meet targets. I promised that we would discuss the target measures, and those will be coming soon, as well as the 2026 strategic plans and incentives from our QHPs. Any questions or discussion?
All right, hearing no questions. I know this was a lot of material today and a lot of data. Please take a look at it. If you have any questions or follow-up, please reach out to us. And we appreciate your attendance and participation in this program as we move it forward. Thank you all for joining us this afternoon. Have a good afternoon. Good afternoon.
Off the air.
Just a moment. Barry, would you mute, please, when you have a moment, or end?